It's here and bigger than ever. The 2021 Harlem Holistic Wellness Week Virtual Expo. Hundreds of vendors, thousands of viewers, dozens of interviews and workshops. April 24th through May 1st, the Global Health Conversation. The Harlem Health and Wellness Week Virtual Expo. For more information and how to become a vendor, visit h2w.nyc. That's h2w.nyc.
We are the sons and daughters of the soul. We are resilient and forever forward-thinking. We ask for nothing else than the opportunity to live and to create the lives that we were meant to live. We want nothing but an equal chance at options and possibilities. The same possibilities and options to live out our potential as our fellow man. We want to be heard, understood, and expressive in our reality. We are the future. We are the creative. We are here.
Hello. Good morning, good afternoon, or good evening, wherever you're at globally. Welcome to the 8th Annual Harlem Holistic Wellness Week on the Love Stream with Dr. Flora, a place where awareness happens, knowledge, freedom, and the flow of the highest vibrations occur here. Discussions and topics that make you feel uncomfortable, as I like it to be. Healing becomes awareness, and the less suffering dissolves, to transform to the heightenings of love and clarity. Today we're discussing an important topic on women's health, fibroids. And to discuss that important topic is Dr. Andrea Perez. Please welcome her today. Hello, Dr. Andrea. How are you?
I'm very well. Thank you so much for having me, Dr. Flora. It's really my pleasure and honor to be here.
It is my pleasure to have you. You are so informative in women's health issues. Please tell the audience a little bit about yourself and the reason why you chose that line of work.
Yeah, sure. So, wow. So my name is Dr. Andrea Perez. I am a family medicine physician practicing for about 20 years now. I can't believe it's that long. So here in the Bronx, I have two platforms here where we see patients for traditional family medicine, and I also have a site where we speak on fibroid health and fibroid healing, and that is a virtual platform. I'm first generation Cuban American, and I am just really an advocate for preventative health and primary care medicine, which I think is just so important as we move through what it is that we're going now in what it is that we're experiencing now in the world, and moving forward.
And so clearly stated, being a Latina myself from Puerto Rico, it is very important to discuss these issues that are happening now, especially during the COVID pandemic that we're dealing with. What do you want people to know about women's health and wellness? And why is it important today more now than ever, especially during this pandemic?
Well, wow. That's a great question. And I would say a family's health always starts with the woman, right? And unfortunately, many times women, mothers, sisters, your aunts, they're the last ones to really look after themselves, not realizing that if their well is not full, there is no way that they can really give all that they want to give, that they need to give to their families. So to me, it's really like a no-brainer. You don't really have to be, a rocket scientist to figure out that the base of any family is the woman. And so we really get to take care of ourselves, not just for Yes, obviously for ourselves, but also for the health and wellness and healing of our families.
Mm. And that's the key front, of this era is to understand that if we don't allow ourselves to take care of our own garden, which our garden is the other face, I like to call it, the private face,
Yeah.
things like fibroids and cysts occur. Can you talk a little bit about what is cysts and fibroids?
I'm sorry, what was your question?
Can you discuss a little bit what is cysts and fibroids?
Sure, absolutely. So, fibroids, first of all, I want to say that usually fibroids are a benign growth, right? They're a benign growth that can happen anywhere within the uterus. They can happen within the uterus, right? In the middle of it. They can happen on the outside of the uterus. They can also occur on the bottom half of the uterus, and it can also occur outside of the uterus. So, it's the fibroids themselves, thankfully so, are normally benign growths that occur, tissues that occur in or outside, or within the wall, right? So here you have the, let's say this is the uterine cavity. It can be right in the middle, right, in that lining. It can be inside the wall of the uterus, or it can be located outside of the uterus. So, as in a nutshell, those are what fibroids are. And what occurs with them is that some women have, some women that do have what we call symptoms, bulky symptoms, which can be pressure, feeling that pressure to urinate all the time, or multiple times. They could have pain with sex. They can have heavy bleeding. They can have, which obviously can lead to other things. And it's important to note, though, also that about 65% of women experience no symptoms. So you may not even realize you have a fibroid until you go for your well woman gynecological visit.
Mm. And to follow up with that question, what are the most important signs to look for when a woman is suffering from fibroids?
Yeah, yeah. So um, really, it can be urinating with more frequency, right? It can be having pain, what we call dyspareunia, which is pain with sex. It could be excessive bleeding. Your menstrual cycles are very heavy. And this is a real interesting piece with the heavy menstrual cycles, because so many of us are just used to having uh, regular menses, which is really a heavy menstrual cycle, that we don't even realize that what is considered heavy bleeding. So that those are some of the symptoms that I would say to look for. Also, abdominal, right? Like all of a sudden you feel that your belly is growing, or it's bigger, or it's puffing out a little, and you're like, well, what's going on here? So by that point, your fibroid is probably a little larger, but it's really also depending on the location of the fibroids that can give you the symptoms.
Mm. And where areas that are very common of locations, areas and locations that are very common in fibroids?
Right, right, yes. So the most common position is submucosal, right, which is actually located within the wall of the uterus. But like I had mentioned, there can be the fibroid can be located just within the wall, inside the muscle itself, within the middle of it, like kind of like that space within the uterus, and it can be out located on the outside of the uterus also, as far as location wise. And it also has a lot to do with I should say the positioning of your actual uterus, right? The uterus normally would be tipped forward in our pelvis. So if you're, kind of looking at the area below your belly button, your uterus would normally be tipped forward, right? But sometimes the uterus is tipped back, and that can also cause, some discomfort with pain and with sex and things along those lines. So, the best way is actually to start, or the first step would be to have your gynecological exam and with your family medicine doctor or your GYN doctor, your gynecologist. And then if there's a suspicion that there could be a fibroid, then we would want to do the first step or the second step, which would be your fibroid ultrasound.
Okay. And what age do you recommend a woman to begin getting a GYN appointment?
Yeah, that's a really, really important question because I have many mothers that are coming in with their daughters once they turn, of a certain age to have a GYN exam. And, back in the day, we used to do once it was known, or maybe your parents thought you were going to be sexually active, right? Whatever that means, right?
Right.
Yeah, they would bring you to go get a checkup, right? To make
Yeah.
sure everything's fine. And
Yes.
but the
Not
reality
only for
is,
prevention for STDs, but
sure,
also to see how enlarged that canal has been opened.
right, yeah. So, and this is the thing, though, we really do not recommend gynecological testing until the age of 21, which I
Okay.
know could be, somewhat like, that's so late. But the reality is that when we do a pap smear, one of the things is that we're looking for is for cervical cancer, right? So, and we know that so many young women have had to have um, procedures because their cells are still not mature enough. So, back in the 80s and the 70s and the 60s, young women would have pap smears and they would be irregular, and then they would have to go through all these biopsies because the pap smear was abnormal. But the reality is that we now know that their cells are just not well formed yet. So that's why we really don't recommend a gynecological exam, or I should say a pap smear, before the age of 21. Now, obviously, if you're sexually active before that age and there's a need to check for STDs, right, or STIs, sexually transmitted infections, then that would be just a gynecological exam, right, where we could do cultures,
Absolutely.
things along the vaginal cultures. And there's also now, the availability of urine tests and blood tests to check for STIs, also sexually transmitted infections. But the actual pap smear for cervical cancer is actually started at the age of 21.
Mm. Wonderful. Thank you for that clarification.
Mhm.
So if you are you ladies out there, young ladies out there watching and listening, if you are sexually active, then before 21 is very important to get that checkup. Thank you for making that more clear. Next question is, what are some tips to prevent a fibroid from growing?
Yeah. So wow. So there's been a lot of research on fibroids as whether there's a genetic composition to it or disposition to it, and I have found that most of the studies that I've seen that kind of gear towards this genetic predisposition have been somewhat flawed, in my opinion, right? I think that one of the biggest reasons that the real underlying reason for that I see for fibroids is really estrogen dominance, right? And so, estrogen is obviously a hormone that we produce, that men produce also. We just produce in larger amounts. And one of the things that we want to do is to decrease our exposure to estrogen, right? So that would be talking about our foods, what it is that we're taking in, also estrogen in the environment, right? In the plastics that we use, in the hair products that we use, our makeup. There's a lot of potential, there's a lot of estrogen or much estrogen in our environment. So really one of the best ways is to really follow a whole foods diet. I am not necessarily advocating a full vegetarian or vegan diet. I think that, if you eat lean meats in moderation, I think that's fine. However, I do know that really eating whole foods, right? So decreasing our fast foods, our prepared foods, really just, going to the farmer's market or to the supermarket to, cut up, the
And
carrots and
cooking your
things
meals and
and
cooking your
to cook your
meals.
meals exactly really
Yeah.
makes a difference, and really watching what products we're putting on our skin. Our skin is our biggest organ, right? So we
Yes.
want to be able to monitor what it is that we're putting on our skin and on our hair and makeup.
Absolutely. And wonderfully said, because as women, and this is, we're speaking to women out here from all ages. You don't
Yes.
have to hit a certain age to remember this. One of the things my abuelita would say, and she's behind us right now, would say this, begin now, begin now. And that meant when I was a little girl watching her, and I was like, ¿Y por qué esto? And why do you do this? She was like, to prevent. I remember her saying that all the time. I wash my face in the morning and I wash my face at night, and I put these creams to keep me moisturized. So when I wake up, I feel bella. And that was simple, And one of the things that I love about our ancestors is to keep it simple. And
Yes.
what is so important is to prevent. The key that I'm
Yes.
hearing from you, Dr. Andrea, that it's about prevention first. And if the case may be that you do have a fibroid, check it. Go
Yeah.
see someone like Dr. Andrea that can assist you with it before it gets bigger and worse and maybe lead to cancer. These are the key tips that we really want people to understand. And my next question is,
And I would add, Dr. Flora, that
yes,
even, one of the things with, Western medicine, which I am part of Western medicine also, is that I see my colleagues say a lot of like watchful waiting, right? It's like, oh, well, your fibroid is small, right? So we're just going to watch it. And I would say, yes, you get to watch it, but also you get to be proactive about, really monitoring it, and in the sense of going back to your diet, right? Are you an ideal body weight, right? And are you eating well? Are you cooking your meals? Are you exercising? Are you sleeping? All of that, you're waiting because you don't need to do perhaps a procedure, but you're really actively combating the fibroid
yes,
by doing all of these
proactive,
things.
yes.
And that's truly important.
Yes. And so my next and almost final question before we have to leave is the belief between Eastern and Western, having a combination of both. Um, is my perspective. I believe that one is not better than the other. And having that combination in philosophy has been amazing because it is a combination. It takes a village to make everything become a better planet. And you coming from the Western background, me coming from the Eastern, I think a combination of both and referring each other helps that person improve their life. What
Yeah.
do you feel about that?
Yeah, definitely. So this is one of the platforms that I have launched virtually, right? Which is the spiritual physician. And within the spiritual physician, essentially really is a lifestyle change. And what I have found is that there really gets to be a combination and an integration of Western medicine and Eastern medicine. And what I have also noted is that when we really address the energetics of why it is that we are ill, or why it is that something has come up in our body. When we address the nutrition, the our sleep, right? What it is that we're saying to each other, right? What it is to ourselves, right? What is it that, what is it that we're feeding ourselves via the words that we say is extremely, it, it, it it all matters, right? And so I take women through this platform, in on this platform, I should say. I take them through these step by step so that we really get to address all of that, so that we can really, heal from fibroids, right? Not just kind of like live with them, but heal from them.
Or layer it up, right?
Yeah,
We're working it. We're going into
yeah,
nitty
we're working
gritty,
it.
and
Yeah,
that's
absolutely.
beautiful. And
So
that's beautiful.
important. So important. So yeah, I would invite any woman here, or any, and the men that love us, right?
Yes.
To, have your loved one, jump on my website, thespiritualphysician.com, and really look at, let's have a conversation and see if you have fibroids or you suspect you have fibroids and you really want to do more than just watchful wait, right? And you're not necessarily ready to do a procedure or surgery or anything along those lines, then, let's have a conversation. And even if it's time to do the surgery, there is a time and place for it. And I do believe that. Then you're going to be so much better when you come out of, this program on the other side for your healing after surgery and after procedure.
Absolutely. Mentally, physically, and spiritually has always been one of my key thoughts in
Absolutely.
combining Eastern and Western modalities because one is not better than the other. Each has its purpose, and that's
That's right.
always been the key. And I think that is important that we need to look at it more now during this pandemic and moving forward. So, yes, check her out, thespiritualphysician.com. And also to look for any information for women's health, please reach out to Dr. Andrea Perez. She is also bilingual in Spanish. So for those that are having difficulty speaking in English and need something more and more clear in the language of Spanish, she would do that as well. My last and
Absolutely.
final word is what word of encouragement for today's listeners today?
Wow. I would just say, you know what? Today is the day that you really get to take hold of your health and your healing. There is no better day than today to do that. And I would inspire you and I would invite you to take the first step. It could be as simple as, taking a walk around the corner. It could be as simple as, leaving the chips behind and picking up a piece of fruit. It can be as simple as, um, you know, eating a piece of fruit. It doesn't matter. It can be as simple as
Simple.
checking your language when you're speaking to yourself. Start today because every step matters in your
Mm,
health and your healing. And
beautiful.
it's for you.
Beautiful. And you know what? It begins with you, it begins with yourself.
That's
Beautifully
it.
said. That's the wonderful way to end it. It starts with you, start now, and start simple. I like to add simplicity is beautiful. And I purposely had a lily behind us today because
I
women
love that,
health
Lily.
speaks on our lily, on our garden. And you women out there and you men out there, please understand your health is so important so that we can continue to move forward and work together. So I thank you, Dr. Andrea Perez, for being here and
Thank you,
supporting
Dr.
the 8th
Flora.
annual Harlem Holistic Wellness Week. Please check
Woohoo!
Dr. Andrea out to find out more information about fibroids. And I thank you for watching Love Stream. Peace and blessings to you all. Thank you.
Bye bye, everyone.
Bye.